warnings about the coronavirus known as Covid-19.
World health officials did what they could to sound positive, even as a list of in countries like Iran.
It is not often that events stop our whole world in its tracks and put our existence in a stark perspective. But this is the case with the novel coronavirus Covid-19, an infectious disease spread by the world's traveling elite and suffered by all. It's one of the hardest trips I've had to make. My uncle Gali Armayau died from COVID, and I've left Lagos to come to Kaduna and pay a condolence visit to his family, my aunt and my cousins. The life of my uncle Gali was a life of service, but a lot of the things that he did for people, he had to do because Nigeria failed. So he was the one who provided, in many ways, social security for many people in the extended family, but also people that, there was no blood relation. He was the one who provided bills, paid for hospital stays, he provided food, he paid school fees. All of that sort of weight on one man would not have been necessary if we had a functional society. And so this documentary, I think, for me, provides an opportunity to try and see if we can look at all the things that COVID has exposed about the things we're getting wrong, the things we're getting right, and how to just make sure that we get things right and focus on building a society that we can all really be proud of. And then if that happens, if COVID has become that catalyst that allows us to self-reflect and from those reflections learn lessons, then the life of people like Uncle Gali and all those who've died from COVID will not have been in vain. Ya haƙuri yanzu kan baba gani sa ya huta yawa kai wannan abu bai daɗi ba bai daɗi ba. I can't believe na shigo gidan nan ba baba gani.
Haka kowa ke cewa kowa sai dinga positioning din shi inda yake. So this is where Baba Gali sits, this is what Baba Gali is doing. Hello.
Shekara nawa auren mama?
32 years.
32 years married and he's gone. Your life partner.
My life partner, my brother, my mother, he was everything to me. You know that.
He was everything to us, Mama.
Yes.
Didn't he look after all of us? He looked after all of us.
He did.
Look, you are doing. You are Baba Gali are doing.
I thought so. So I could go now kafa uku.
Mai cikin Baba Gali. Sorry. Shiga ciki mama Hawa. Bari mu kyale su. Sorry. Kai. Zainabu. Ya kike mai jira kai yanzu ni ina yawo yanzu in ba ku komai. Kai. Mama Hawa mun yi rashi mama.
National Institutes of Health is launching a study to learn more about how the coronavirus... But in countries like Iran, the impact of COVID-19 is harder to gauge. World Health officials did what they could to sound positive, even as the list of affected
Canada's
countries
chief
with the
public health
virus
officer
grew.
says the remaining 195 people under quarantine at CFB Trenton have been...
The virus is first reported in Wuhan, China on the 31st of December 2019. On the 11th of January, China reports its first death. 21st January 2020, the World Health Organization Western Pacific Office confirms the disease is also being transmitted between humans. 22nd January 2020, Nigeria's Center for Disease Control NCDC boss, Dr. Chikwe Ihekwazu, issues an official public health advisory statement alerting Nigerians while calling the threat to the country moderate. 30th January 2020, for the 6th time since it was established, the World Health Organization declares a public health emergency of international concern, a designation reserved for extraordinary events that threaten to spread internationally. The question beating in many hearts at this point is, how prepared are we?
In late January, I was actually invited by the World Health Organization to be part of a mission to go to China to understand what was going on there. By then, we already had a significant outbreak in China. And that mission was so eye-opening and terrifying in terms of the prospects for the world. Seeing Beijing the way we saw it in February was almost unimaginable. You know, there was nobody on the streets, you know, absolutely no one. So we went to 3 cities in China, including Wuhan. A small part of the team actually went to Wuhan. And 2 things I could not forget. In fact, 3. One was the one I'd mentioned, the absolute silence of cities I'd always recognized as being full of people. Secondly, was that every single person I did see was wearing a mask. So the level of compliance in a society that was faced with this challenge in a big country like China was incredible. And then finally was about the response. You know, I looked at the infrastructure that they had built up. You know, given that I've been in this work for quite a while, China did not have a CDC before SARS, one of the last big outbreaks. And post-SARS, they built up this big China CDC with branches all over the country. And I could see how you could activate a public health architecture to respond to an outbreak in a way I was worried immediately that we didn't have. Yes. Right. We're in a very rudimentary stage of our development. So I think it was at that point that I really realized how big a challenge we could potentially be facing.
Nigeria held its breath, with Lagos State, where the nation's key entry points are located, doing its best to prepare for the inevitable.
Every evening when Abayomi calls me, I'll be like, has it happened? I mean, that happened for like a week. So it was a mixed feeling. Do you understand? I mean, when you know that this thing that is waving around, it will eventually come. So it was more of, if it appears, how ready are we and how are we going to contain it?
The moment it started to spread out of China into the rest of Southeast Asia, we knew we were in trouble. So we ramped up our biosecurity plan. We've been slowly planning, WHO said expect something. There are a group of scientists around the world that talk about global biological existential threats. And they've warned that any time from now, we're going to see something big. WHO calls it Agent X. X meaning you don't know what it is. It's a novel pathogen. So we knew that COVID-19 was Agent X.
Lagos State has set up an incident command system because we knew that it was a question of when and not if. Yes, we knew that. Yes, we knew that. So we have set up that, and then we started renovation on this building.
In late February 2020, as worldwide cases surpass 83,000 with at least 2,800 deaths, it happens. COVID-19 lands in Nigeria.
We're actually, we're waiting. Literally, we're waiting. So by end of January, we had put up the small facility. We've looked at our biobank. We've looked at a few other, epidemiological things that we need to have in place. So it was just like a waiting game. That when is it going to happen? But unfortunately, we're all looking for a Chinese.
You thought
well,
it would come through
because
China?
that's where, the thing was still very prevalent. So we never knew that the person was going to come from Europe. So when it actually happened on February 27th, what I said to him, I called the Minister for Health. I said to him, call the NCDC. The Minister for Health called Mr. President. We actually handed over that communication to the federal government.
If you think back to the first case, from Lagos to Ogun State, and you remember we found all the contacts, we isolated them, we found the one case among it was a very good public health response, and for a while we thought we've got this,
You must, for every patient that is infected, you must trace all the contacts and somebody must get in contact with them daily. There's an arm of a pillar, an arm of the Emergency Operations Center that is called Epidemiology and Surveillance, and they have a large number of people. So they have to deploy their staff to, one, trace all the people that were in the flight with him. They have to trace those that the driver and the protocol that met him at the airport and drove him to the hotel. The people that he met at the hotel, receptionists, people that he interacted with at the hotel, everybody was followed up. The driver that took him to Ogun State, they were all followed up. And then the people he also interacted with within the premises of the compound.
And I'll tell you one of the strongest shortcomings we have is data. What do I mean? So when somebody comes in, just arriving, and you say they should fill the form, and they just hurriedly fill the form in 1 minute or 2 minutes, there's no way you could confirm that those addresses were genuine. You understand? So data now became an issue for us when we started the contact tracing, because we now realized that somebody had given an address that really doesn't exist. But I was now wondering that if we had a prior data, somebody in America, maybe that's why they were so confident. A social security number is social, they will track you in no time. You're a unique identity.
At that point, we were anticipating already that there will be a case. We had built up, prepared a couple of labs in Nigeria to be able to make the diagnosis. One of them was the Lagos University teaching hospital, the lab there. We supplied them with all they needed to make that diagnosis, and we did a few training exercises. So we're on the lookout.
The quick response leads to the setting up of a presidential task force on COVID-19.
The key role of presidential task force is really to have a multi-sectoral sort of coordination role. So we work across the various ministries and departments within government to make sure the entire response is cohesive. Fortunately, there have been other pandemics in the past, there have been other outbreaks, and the way you manage outbreaks is fairly similar. You tend to set up a sort of incident command center where you have somebody at the top as the national incident manager, and then he has a number of pillars that feed into surveillance, for instance, case management, point of entry, infection control, laboratory, etc. And they meet regularly and usually on a daily basis or even twice a day to go through the entire data side to look at the interventions. I'm the coordinator, so the National Incident Manager actually reports to me, and in turn I report to the main board of the PTF.
The cooperation between the government and policymakers within the government was unprecedented.
If you were not cooperating before, because this is the roof over everybody's head coming together, whether you are a monitor or fiscal authority, you don't have a choice but to come together. And that's the reason, like you may have heard, immediately this pandemic set in, the president responsibly set up 3 groups. In June 11th, he said that this is going to be funded through government budgeted expenditure and central bank structured financial and economic palliatives to support the growth of the manufacturing, the SMEs, as well as the agricultural sector.
While the response to the index case is a good public health response, it is generally believed that Nigeria left its flanks open, that more could have been done, specifically the closing of all ports of entry after patient 0 landed in Nigeria.
There are a few things we're doing right, a few we're not. We're not prepared. We didn't prepare enough. We had all the chances to prepare for this epidemic. I mean, since it started in Wuhan and all those places, knowing our health structures, we should have prepared ahead of time for that. I mean, for me, I would have thought that the day that first case came into Nigeria, they will have locked our borders. Because if you look at the figures from from NCDC, the 50,000 cases we have came directly or indirectly from the 850 people who traveled into the country. So if it had been 1 instead of 850, we probably won't get what we're having. And therefore, that's what I mean, say we're not proactive enough. I don't know why we waited that long before we locked our border.
We were fairly aggressive, actually, in closing our airports. Of course, we would have won a bit of time if we closed a week or 2 earlier, but I'm not convinced that we could have stopped Nigerians from coming home. We would have made it more difficult. But remember, people kept coming even when the airports were closed because there were always exceptions. And exceptions primarily for Nigerians because they have a right to their country. Hindsight is a great thing, but at that time, we had no understanding of the level of asymptomatic transmission that happened. So even all the things we were doing in good faith, like screening people at airports, really would detect a small fraction of the case.
On the 24th of March 2020, Lagos State issued an alert confirming that one of the people who tested positive for the COVID virus was an attendee at the prestigious Africa Magic Viewers' Choice Award, which was held on the 14th of March.
It's my honor to introduce the Best Multi-Choice Talent Factory Film Award. Here to present the award, please welcome ace journalist and media entrepreneur, Kadaria Ahmed.
I was one of those attendees, having presented an award at the show, and although I tested negative, I understood firsthand the panic that was gripping the nation as the number of cases started to rise. I didn't know that that was just the beginning of a fearful and difficult time. On the 30th of March 2020, President Muhammadu Buhari makes a national broadcast and finally announces a 14-day lockdown of Lagos, neighboring Ogun State, and Nigeria's capital Abuja starting from 11 p.m. A nation known for its ever-busy streets and markets, its boisterous parties, gatherings, and colorful people, went quiet, leaving emptiness, despair, and fear. There was a very eerie feeling of uncertainty because the world as we knew it began to change before our very eyes.
It's a difficult time to lose someone because you're handicapped by the environment. You don't have the support of people that you normally would if that happens, because there's social distancing, there's a lockdown in the town, so people can't even visit you, even though that also has its good part. But the toughest part is I have two of my siblings who live abroad. And even though my dad has always told us that we must bury him within a week, so we all knew that. My mom died 19 years ago, and we buried her within a week, and he always reminded us that he wants exactly that. So when this happened in the middle of this difficult season, you couldn't even leave your house. But we also then wanted to meet my father's demand. You know, we were committed to that. And it was difficult because my siblings could not come. Airports were shut.
And I imagine they would want to say a final goodbye.
Yes, it was difficult for them, not being able to. For closure, sometimes that's really what you need, being part of the process of burying someone. But we had to do what we had to do. It was very strange to have a service for 20 people, including all your providers. That's the pastors, the music, the photographer. So by the time you were done, you barely had 12 slots for your own family members. After the first week of the actual lockdown, you could begin to see the trend of the issues that will arise. And I remember a story that one of my security details told me within the period. Said that one of their colleagues, a police vehicle, was going from, I think, Bagada area to Maryland, and saw a woman and her daughter, and they were walking. And so they asked them, where do you want to go? Can we give you a lift? And the woman said they're going to, I don't know, maybe Maryland or something. I said, you want to walk all that way? She said, well, we don't have a choice. That normally she sells things in traffic. And she can't sell anything. All the little capital she has for that, they've already spent eating. And their neighbor, who doesn't have much herself, that helps them for the last 2 days. And she and her daughter were walking to her sister's place, somewhere around Maryland, to see if she had any way that she could help them as well. So I knew that, multiply that by millions.
How will millions of people across Nigeria, especially low-income earners and those who survive on daily wages, cope with the lockdown? We're on our way to Monkey Village, an informal settlement that sits on a canal in an area called Ikeja in Lagos State. Lagos is, of course, the commercial capital of Nigeria. It's the richest state probably in the country. This place sits just a 15 minutes drive from the seat of government, but it is a ghetto. It houses the poorest of the poor. Betty.
Sorry, what do they do now?
It's like this. And another one. Yes. So this is Betty Abba. Hi, Betty. So what are we here to do today?
So today we are here for food relief because, of course, this is the COVID-19 period where lives and businesses are shut down. And so because this kind of community, they survive on a day-to-day basis. So for so many of the families, it's not just the livelihood of the parents that are disrupted. It's more like an existential threat. There's a lot of starvation, and communities like this are more prone to starvation. So we bring the food to the community members, especially the children that are on our program.
So food is a major issue in this pandemic.
It's a very, very major issue.
Shall we go? Let's go through. With the COVID-19 lockdown in place, daily conversations revolve around the importance of physical distancing, washing of hands and use of face masks in prevention. I've come to find out how these measures are being observed in places like these, which are representative of the low-income communities across the country.
Okay, all right. You know, this is the time of COVID-19. How many of you have heard about COVID-19? Okay. You know you're not supposed to be sitting closely like this. Yes. Next time you have to sit very far away. You hear? Yes. And you're supposed to use your nose mask. How many of you have nose mask? You have? Why are you not using it? Use it. Let me see. Use it now. Here.
Your sister have.
Use your own. You see? Clap for yourself. Oh, can you see him? Sit down.
Sani da kokari. Ya kuke?
Alhamdulillah.
To, yaran ku an zo muku magana wannan cuta?
Gaskiya ne.
To gashi mu kuma buku kare kanku ba. Akwai? Amma ba a sawa.
Akwai. If you pass mo put no comot.
Amma a nan cikin gida ba ku sa ba.
A'a.
Ba ku ji tsoron yara? Za ku sa.
All of them buy small, big person, all the get
But you don't want to use them.
You go use them.
Not supposed to use them.
People think, well, I haven't eaten. Why are they worried about COVID? And meanwhile, the fact that nobody's really looked after my family, I wake up in the morning, I don't have anything to eat, I don't have a job, etc.
How will the poorest Nigerians who rely on daily income cope with the effects of the lockdown?
I'm working inside this Oniru and washing clothes for women. But now, since when they close through coronavirus, I don't have a job again. My beginning is going to school for Bethesda School for Ikota. No more school, no anything, even church. And I live inside this ghetto where they break. Now, no any food for me, no house. I'm sleeping outside. Sometimes we see some people allow some police will come the night. If we pursue, I will start to run. I have to wound with my bikini that day. Day before yesterday. But it's not good like this now.
They don't tell everybody to beggar for this Nigeria, for this Lagos, or for this country. They don't tell everybody to beggar. Like me now for Igbo, now I lose leg, so I come this place because we make a chop food.
This initiative is about meeting people's need. People are hungry, and it was funded by almost everybody, all the stakeholders, people from abroad, the London, the US, people from the Lekki estate, outside Oniru, everybody from 500 naira to 200 naira to as much as ₦1 million, everybody has donated and funded it. A lot of people, more than 100 people.
People have to make money to feed their families. And when it comes to hunger, COVID-19 looks set to take the back seat. I'm in Ladikwa International Spare Parts Market, also known as Ladikwa Market in Lagos. This is the place that essentially enables Nigeria move, because as you well know, most people cannot afford new cars. And so this is where they come to buy the parts that they need to get their vehicles moving. It is believed that there are people working in this market selling anything from spare parts to electricals and a whole myriad of things that keep cars moving. When the lockdown was announced, there was a huge loss here because people had to shut down completely. Now the government has decided to allow the market to open at least 3 times a week. So it's open on Monday, on Wednesday, and on Friday. And it is business as usual. I didn't see any evidence of social distancing, and a lot of people are going around without masks.
When it comes to COVID-19, in the whole of Nigeria, some people still do not believe that it exists.
Is that the case in the market? Is that why we see people walking around freely and not wearing masks?
So, yes, it can be.
Well, it's unfortunate that up to this time, especially in this place, in this country, Nigeria, that we have people still denying the existence of this. Because we are witnessing an increased number of deaths, some of which are unexplained, and scientists have been able to link these deaths to the possibility of COVID-19. At least since it is a matter of life and death, nobody would want to experiment with his or her own life. It is better to accept that the disease is a reality and we take the necessary measures than for us to discover it when it is too late.
So you see, we describe a biosecurity threat as a tripod of biosecurity containment. So there are 3 legs to that tripod. The first leg is the public health crisis. In trying to manage a public health crisis, which is one leg of the tripod, you don't want to create a new crisis, which is an economic crisis. And then there's the third leg, which is the issue of security. So in balancing an outbreak, you have to have all those 3 legs balanced to keep your community stable.
Inside we have rice, 10 kg of rice, 10 kg of gari, 10 kg of beans, there's vegetable oil and salt. It's from the federal government Victim Support Fund. Okay, so who will help me?
No,
2 of you. Thank you so much for getting me a glimpse of the work that you do here. Yeah? Thank you so much. I really appreciate your coming and for showing interest in our work. And I believe that the rest of the world will see the reality of the impoverished communities in Nigeria. The majority of people who have been rendered very extremely vulnerable by the COVID-19 pandemic and associated disruptions.
There's no way government can do everything that is required. There would be areas that they can't touch or areas that they can't see. We've done a lot of welfare because we realized that was major. So we are mobilizing funds, and then different organizations who have set up structures to be able to reach people, we're funding them to execute it. So I'm a firm believer in the fact that some people have too much and some people have too little. But that every time you bring the too much plus the too little, you'll have more than enough for everything we ever need to do.
I understand you had issues at the beginning of the lockdown with your bosses getting attacked.
Yes, that was a very difficult period. It's still a very difficult period. During the when we're distributing relief packs, because people are hungry. We help Greenpeace to plan and distribute, but we did not factor in that there are new vulnerable people, and these new vulnerable people are angry people, because on a good day they would not queue to take relief packs from you, but now they've not worked for a long time, and they find themselves queuing to take relief packs. So they're very angry. So when it finishes, before they get, people want to attack the boss. Sometimes when we go to a place, it's organized because we work with the local government. They help us to organize. We use security, but we use the local government as well because we've found out that a lot of thugs and normal people are hungry.
How has the COVID-19 pandemic affected your work, if it has, that is?
Initially when we started, all of us were afraid in the office. Some didn't even show up. Some parents and spouses insisted that their wards go back home. And my own family as well were wondering why we're still opened, So at this point in time when people need food and they need a delivery company all over the world, what should we do? We can't disappoint our customers, people are relying on us. And a lot of farmers, when they grow these things, they're relying on hotels and restaurants and all that to buy bulk. And we also buy. So they are stuck with food. Then also they are stuck with their staff not being on the field. Then transportation, there's no transportation for them to move. So you have gluts everywhere. So we have a lot of our farmers not being able to supply us. Then even in Mount 12, we had issues there as well. So of course, the agri value chain is not even well developed as well. We only have storage for grains. We don't have storage for vegetables. There's no cold chain anywhere. There's no pack house anywhere around the country. If there's any, just few. So now, this was the time that it showed that all the structures, the infrastructure were lacking in the agri value chain, where investment is required. And this exposed it. So it made our work very, very difficult.
So all the shortcomings?
All the shortcomings. It made it very difficult. Oh, yes, it did. So we had to do a lot to stay open. We store our grains here and rice here. This is Nigerian rice, and I'm so happy that the country was able to, promote made in Nigeria rice before this COVID started. I don't know what we'll have done without this happening. So throughout this period of COVID, everything we supplied was Nigerian rice, different types of Nigerian rice.
But in the middle of this show of compassion and communal cooperation, a dark cloud emerges, making its way to the forefront of the battle against COVID-19.
Two weeks before I was declared COVID positive, which was on the 20th of March, I had been going to Abuja several times for meetings of the National Economic Council, Governors Forum, and so on. I was appointed by the Nigerian Governors Forum to chair a committee on the public health and economic response to COVID-19, because it was clear then the prices of oil had collapsed. We were going to be in trouble. How would we respond? And a committee of 7 governors was formed, and I was made the chairman along with other agencies. So I was going to Abuja a lot. I was doing my best to take all the precautions, but the moment one of the governors, the governor of Bauchi, Bala Mohammed, was declared positive, all the governors that sat near him went into self-isolation. I didn't sit near him, so I didn't think I could have got it that way. But the fact that I was interacting with so many people around that time, and COVID was already in Abuja, made me begin to feel, I could get it. So I wasn't surprised. Secondly, I had headaches and felt like I had fever. But when I came and I complained to my doctors, they said, look, you need to rest. You've been overworking yourself. It's stress. I remember the deputy governor said, sir, you should take 2 days off and sleep. You just need to sleep. You're okay, But the headaches persisted. I called the Commissioner of Health. I said, I want to be tested. I don't recall when the day that happened, but the first result came back inconclusive. So they said, wait a few more days and be tested. Now, throughout this period, I had headaches. I was weak. I wasn't functioning properly. So I knew there was something wrong. So by the time they came on the 28th and said the second test, because after a few days of, saying inconclusive, I said, come back and test me again. By the time they came back on the 28th and said I was positive, I was not surprised.
When the results came out, because we all took the test together, but when it came out and it was positive, I was in a meeting. I ran out of the meeting and so many thoughts were just running through my head. Like when the doctors come in and see him, I go and whisper, so how is it? I was so afraid of the perfusion, his lung perfusion, but all through it was okay.
I thought it was important for the people of Kaduna State that elected me to know that their governor is not very well. So it was important to make that disclosure and to assure them that the state will run and this is the person in charge. Secondly, I also thought it was important for people to know that this disease is real and not to be in denial. I've got it. I'm the #1 citizen of the state. I also happen to be the #1 victim of COVID-19. So don't think you're protected.
COVID-19 was referred to as the disease of the elites in media reports and social circles because it was thought to have been brought into the country by the affluent, many of whom featured prominently on the COVID-19 fatality list.
The biggest mistake anyone would make if you have coronavirus is to go to a private hospital. Okay, because private hospitals are not used to dealing with infectious diseases. It is public hospitals that have experience in dealing with infectious diseases. And we suddenly found ourselves dependent entirely on the public health system because of this reason, and also the fact that the world has closed down. The elites can no longer run away to London, Germany, or Dubai for their medical treatment. And I think it's a good thing that it happened that way, because it will force all of us, policymakers, that had the luxury of flying out if we had any serious medical problem, to try to solve the problem here.
When we started, the main challenge we had to do with testing. We had insufficient testing capacity. We started off with very few labs right from the beginning. In fact, at the beginning, we had 0 labs testing for COVID, just like any other country. By mid-April, we had about 12 laboratories covering 8 states. We now have 51 laboratories throughout the country with a capacity of about 10,000, up to 10,000 tests a day. But then we only do about 2,000 or so per day.
There are many who argue actually that given the size of our population, those numbers do not actually represent a significant testing capacity.
No, they don't. We are definitely under testing.
Now, why are we not testing? There are a series of reasons for that. One is the ability of the public health system to collect the right samples from the right people. Logistically, there are special tools to collect samples, nasopharyngeal swabs, something we call the virus transport media, because you have to put what you collect in a preservative to enable the virus to be viable when it gets to the lab. So there's all of that needs to be distributed adequately around the country.
And we don't produce any of that.
We don't produce any. We import all of this. The one thing we do produce is the virus transport media. It's produced at NVRI in Jos, the Nigeria Veterinary Research Institute, which is actually a great example. Then secondly, there's the stigmatization around the disease. Up till now, people are still hesitant to test, even when they are symptomatic. Sometimes, it's hard. you see doctors that have treated someone with 2 rounds of malaria medication. The patient is dyspneic, in respiratory distress, and still there's some hesitation to take a sample from both sides. So, and we're working very hard through communication to say, listen, this can save your life and keep you there for your family to enjoy. Then there's the actual issue that most people think about, the lab infrastructure and reagents. And then there's the final step is getting the results back out of the labs, which has also been a problem to Nigerians sometimes. So we're working on each step of that. And we've set ourselves a target of 2 million, testing 2 million people. We're just around 200,000 of that. But we were clear when we were setting the target that it was unlikely that we'll reach that target. But we wanted to set an ambitious target that will push the whole system forward. And what that has done is we're building. You know, very often when you're building from the ground up, a lot of what requires to be done is not visible, and suddenly you see a structure emerge. So there are lots of components to the 4 steps I just spoke about that we are building on continuously. And like I said, this is a marathon. You know, we will have to continue doing this over the next year at least. So this is not something you just can find someone to bring in a few things and solve the problem. Rather than organizing procurement, we're organizing a supply chain of a constant flow of the reagents that we'll need over time.
So this lab, what we have now, is significant in the fight against COVID-19 because it is the national reference lab of the nation's public health institute. So the NCDC is leading in the response, or is the agency that is directly responsible for the response to COVID-19 and all other infectious diseases. And one very critical aspect of response generally to diseases is the diagnostics. For you to be able to fight, prevent, give response, you need to know exactly what is causing it. And that's where diagnostics come into play, and the laboratory is at the forefront of that.
Why is it different from all the other labs that are dotted around the country?
Well, I wouldn't say different, but in the sense that what we do here, a lot of that is public health diagnostics. So you have a lot of labs that deal with pathology, chemistry, the usual, but this is more specialized.
There were times in West Africa when we needed to send specimens to labs in Senegal.
Yes.
Has that changed since the start of COVID?
Well, not necessarily completely, but we're working towards changing that. Mm-hmm. What you will be talking about will be the testing or diagnosis for yellow fever, part of the yellow fever response. A lot of that work started decades ago, even before the institute was set up. So that system was set up before now by the WHO, and it's a regional system. So what the lab in Dakar really is a regional lab that covers the entire region. So before the advent of this lab as a national reference lab that covers the country, that system has been set up. And it's not just Nigeria alone. All the labs in the West African region need to send their samples for confirmation. So it's a 2-part thing. The diagnostics is also different techniques. So one of the techniques, which is based on PCR, confirmation by PCR, we now do here. And we are already halfway through that process of ensuring that the global community agrees with us that, because again, it's an agreement. Okay. So we're working within a network that is not just left to Nigeria alone. So whatever precedent we set are things that other countries will follow. And we are really the first country in the region, in Africa region, really, to move away from that, to insist that a country needs to have the capacity to do that by itself. So a lot of countries are now taking a cue from that. WHO is using Nigeria as an example to say, countries are building capacity and taking ownership of their systems, not just waiting for WHO to do that for them. So we go to meetings and we're asked to make presentations on how we build this capacity. Other countries are learning from our experience. So again, it's a work in progress. We're not finally there yet, but it's one step at a time. We're closer there now than we were 2 years ago, than we were last year.
Since Ebola, we've put several things in place. The most important thing was what we discovered during Ebola was we didn't have what we call a biosafety level laboratory and biobank. When you're dealing with dangerous pathogens, you can't manipulate dangerous pathogens in a normal laboratory.
Why is it important to manipulate them? Is this for research, to do what exactly?
Well, first of all, to diagnose, and then to be able to store, and then to be able to do research. These pathogens are very, very dangerous. You know, they're called pathogens of high consequence. And you need a very special environment in which to manipulate, to manage them, to process them, and to make your diagnosis. So we built what we call a biosafety level 3 laboratory with a biobank. And we've been building that since 2016, and we commissioned it in 2018. And it's inside this facility in Yaba. If we could test 20 million Lagosians, we would. But nobody has the budget for that. So we have to test strategically and try and understand what the virus is doing in community, and then use that to extrapolate our strategies. So right now, we're expanding our testing. I mean, we're testing more than any other part of Nigeria.
Because you are the epicenter.
Yes, because we're the epicenter, but other states will become the new epicenters. So people get scared when they see our figures, but our figures are a direct consequence of the fact that we're testing so much. If other states test as much as Lagos, they will find positive cases, you know. So you see Lagos up there, you know, and everybody else is lower down. It's a factor of Lagos State as being the first. It's a factor of the environment of Lagos, and it's a factor of our rate of testing. And we're ramping up as fast as we can. We're also bringing in the private sector to help with testing.
We in Kaduna State are doing all we can to be ready. And as I said, from about the 28th of February, we had started thinking and planning what to do if it gets here. We had undertaken an assessment about our infectious diseases capacity, how many beds we had. We had 16 beds only. But we
when you say 16 beds, so what, ICU beds or?
These are not even ICU beds.
Just normal isolation?
Normal isolation center for infectious disease. We had only 16 beds hospital. So it was clear to me that, you know, there was a lot of work to be done. But luckily we had people that were trained. So we had the personnel. We just didn't have the facilities or the level of preparedness. We had no testing capacity at the time because the only test center was in Lagos. And we began to think, how do we get more testing centers? How do we do this? We knew it will get here. We're not in denial from day one about it. We increased investment, we increased capital investment on health. Even the recurrent investment had to increase because we have a 10% across the board increase in health workers' salaries, all health workers in the state. And those on the front lines get special allowances that amount to hundreds of thousands of naira every month. So our recurrent expenditure, personnel cost, and so on health also improved. We had to buy more vehicles for contact tracing and more equipment. So the health budget rose significantly. I cannot recall by what percentage, but budgets of other ministries, departments, agencies, and sectors had to go down. We had to scale back on some of our physical infrastructure ambitions. You know, we're doing a lot of urban renewal in Kaduna, Zaria, Akafanchan, and we had to be realistic and reduce that so that we can put in more in ensuring that we have this 20 to 30 bed infectious diseases wards in each local government. And we also invested in buying test kits. Kaduna State is the only state in Nigeria that has been able to get 10,000 test kits direct from the manufacturers of gene expert machines. In fact, we're the only state with capability now to use gene expert machines to test for COVID, which is far more accurate than the PCR that is commonly used all over.
The opportunity for COVID is to build a resilient health system. So what are the things that we don't have, that we should have, that the opportunity of COVID has presented, especially that you have support, you have donor support, you have grants, you have the CBN giving an intervention and saying if you want to build resilience in the health system, we can give you very favorable terms for getting health sector funding. We conceived it as an infectious disease hospital. And part of what we're trying to do with the construction is to have demountable materials within.
What does that mean?
It means that we can change the configuration of the rooms anytime there's a need. So for now, we will be using it for COVID, which is a slightly different configuration to if you're using it for Ebola or if you're using it for Lassa.
Okay.
And then also for multi-drug resistant TB, which is one of the things we treat here. So now we will configure it to suit our needs for COVID. We will have an ICU and high dependency unit where if
How
they have...
many beds?
At the moment, we will have 12. This is born of the fact that what we see, most of our patients that we see, really about 70 to 80% of them don't have severe disease. About 40% of them actually have no symptoms.
We don't trust our government. The government doesn't trust us. We don't trust them. They lie to us every day from the campaign rally up to the day they get in government. So when they bring out a figure, who cares? I mean, it's the same government that lied to me yesterday. So why should I believe their figure? And you remember during the Salah holidays, PTF has to come out itself to say that we're not testing as much as we should. Long before then, the story was then going around. Nigeria is now flattening the curve. We are now out of this. And I think I remember a week before PTF came out, doing analysis of what we're doing. A week before the Salah holidays, we tested about 11,000 samples. And our positivity rate was about 10% or so.
10%
of the 11,000
11
tested.
that you tested.
The week after the Salah,
So if we extrapolate, we can generally...
Yeah, you can say, but on the basis we surely have no. But the week during the Salah, we tested only 5,000, half of what we tested. And the positivity rate, unfortunately, was like about 12%, 15%, higher than what it was in the time of this. Which means when you really extrapolate, those figures they were giving was like 1.5 less than what it should be. And that's where we're talking about flattening the truth, because you're not giving those figures. And again, back to the issue of the states I'm talking about. If you're telling me that my state has 20 cases, but you're not telling me how many I'm testing, it is not,
makes
it's not
nonsense
the true
of
fact.
the numbers,
Yeah, the number, exactly, makes nonsense of the numbers, And again, people look at the large numbers, say, oh, Lagos has 100 something, Abuja has 40. But then, how many did you test in Lagos? How many did you test in Abuja? So when you prorata, you find that you even have more situation in Abuja than you have in, and therefore you will be in a better position to say, this is where my hotspot is. This is where I should focus my attempt. But then we put all the effort on Lagos, which is not as bad as a few other countries.
One of the problems that we've seen with the COVID-19 pandemic is a lack of information and a lack of transparency in the way agencies involved with the management of the disease have handled cases. And so what citizens, patients, their relatives, and even doctors have done is to find alternative ways of blowing the whistle and ensuring that the public knows exactly what is happening, both to them, but also to the systems, the hospitals that are supposed to be containing this disease. They've used journalists, basically, utilizing social media to whistleblow, to give out information, and then what those journalists have been doing is essentially forcing the hands of agencies and governments by calling out these particular cases.
There are times when the information comes and you know that the public need to be aware. Take Ilorin for instance. If the public didn't know that there was a possible case of COVID in that hospital, we would never have been serious about contact tracing. It wouldn't have happened, and then more people would have been infected.
Are there sort of any common factors that you can point to in sort of the stories that are coming out, the kind of people that are coming to you? And I'm asking this with a view to saying whether there's a pattern that can be, seen in the way we're managing the pandemic across the country that is emerging based on what you are hearing.
Yes, there's a pattern. Self-denial, both by public and private institutions. Self-denial, cover-up, lack of or inadequate provision of the PPE, bad enforcement of the lockdown. What else? I mean, these are the common themes that are a lot of times common themes to many states.
The question that Kogi State is surrounded by 10 states, including 10 borders, including that of FCT, and that these various states are afflicted or inflicted or affected by COVID-19, and that Kogi State must have. I say it's lie, it is false. That is where effective leadership is tested. Here in Kogi State, we have effective leadership, and we have very respected and effective followership. And our people took to our words very well, and they protected themselves, they protected the community, and they protected the society. So imposing this particular lockdown in Kababonu local government is very painful. But we have to take the decision as a result of this purported allotment in order to clear the air. Kogi State remain COVID-19 free.
The DG protocol was interacting with us just now. He exchanged mic with you, the team lead. I think, and a handshake, which is against the NCDC protocol. So we will observe the protocol of going into isolation. The team together with the DG protocol.
It was a setup, you know, because he didn't just say NCDC going. No. He said you shook, you had a handshake, which shouldn't happen. So go into isolation.
We have not only flattened the thing, we have buried the truth in Kogi State. See Cross River before the issue came in. The governor kept saying it's not possible. And then when he knew that, you know, the thing was going to blow out in his face, he shifted it to the federal government and said, oh, now you have opened the borders, and it's the people who are coming from outside who are going to give me this. But that's not the truth. They were having cases in Cross River. They were not testing. We have the occasion where we ask the people where they said they have tested, where did you send your samples to? They said they send it to Urua. You call Urua. Urua said we never received any samples. Those things I'm talking about flattening the truth. As far as the concern was concerned, they would pretend, collect the samples. I don't know whether they were flushing it in the commissioner's toilet or something, but they were not sending it to the labs. And the labs, so therefore the state kept saying all our cases are negative. All our cases are, but then you never send the sample to anybody. So how can you say it's negative? So these are some of the areas. In some of the states, I'll give you one good example. I think it was either Sokoto or Zamfara. NCDC puts up a figure and says 900 and whatever. The guy who is in charge of the lab, who happens to be in our committee, says, look, on my record, I have 2,000 and something cases. You can't be thinking of 900. This is the report I have on my table. But and why does that happen? The results are sent to the state first. The state waits some time, amends, adjusts, you know, and then send that to NCDC.
Majority of them don't really care about the people. That's reality. Majority of them care about their pockets, care about their power. They want to perpetuate themselves in office. It's not about the people.
You think they're not? What about those who argue that it might be about managing public reaction? They don't want to see panic. They don't want to see people, you know, doing things that may jeopardize the health of others a little bit further.
What you need to do is prevent a situation that will make people panic in the first place. Prevent that from happening. Not that you encourage that to happen and then you don't want the public to know. That's not the way to go about it. You know that staff will be apprehensive if they attend to patients with COVID symptoms without PPE. Then give them the PPE. Not that someone wants to report later that, oh, there are no PPE, and then you want to manage the info. No, that's not what you should be managing. You should be people should, especially healthcare workers, should go to work in this moment comfortable. There is a state, and I'm not going to mention that state for now, because the source who gave me doesn't want it out yet. There is a state where X number of people worked in case management. When allowances were going to be paid, 7X number of people were paid. Times 7 of the people who did the job. So, who created all these accounts? Who are these individuals? Multiples of 7.
So it is still that Nigerian problem of us taking a problem and trying to utilize it for personal gain. People making money off the misery of people who are infected with COVID. That's what you're telling
It's
me.
people making money regardless of the mystery of whether there is mystery or not. The priority is to make money. You know, it's not deliberately about profiting from COVID victims to enrich. It was the agenda was always about self-enrichment, and this is just a continuation of a pattern. It's not. I don't know if you get. It's not specific to COVID. It's a mind shift that hasn't yet happened.
Let me put it this way. This is an evolving disease. Nobody knew what it was going to turn out to be. When it started as a cough, as a this, and then gradually it's becoming what it is now. We learn every day. At the time those things were said, we looked at the situation in Europe and said, if it comes into our environment, this is what is going to happen.
Yes.
Yeah, this is what's going to happen. But then it didn't come out that way. There are many, many factors. In fact, we don't answer. It's not because we're doing anything right. Well, let me not say anything right. It's not because we're doing things right. There are a few things we're doing right, there are a few we're not. You know, we're not prepared. We didn't prepare enough. They think it's a reflection of the failure of your system, and that's why we're not controlling it. And nobody wants to give the impression that it's a failure. And so many countries are saying, oh no, our number is just two, this and that, to give the impression that things are under control. And therefore, that's part of a national thing, call it nationalism also, you know, trying to give an impression outside that you are doing well when you are not.
My feeling is that it's partly driven by lack of funds in the States. And sometimes it's easier for you to just say, I don't have a problem, than to face the prospect of having to look for additional funds to sort that problem out.
From federal to state and right down to private sector intervention, it was akin to a state of emergency. But it is getting clearer by the day that these stopgap interventions are not just signs of unpreparedness, but that the COVID-19 virus has peeled off a layer of our present reality as a nation, revealing a rotten underbelly. We are walking the grounds of UCH, Nigeria's oldest university teaching hospital. At the time it was launched, I think in the 50s, 56, it had cost something like 4.5 million pounds to build, the equivalent of something like 27, 28 billion naira. And it was state of the art, comparable to any in the world, and for a very long time was a center of excellence in the Commonwealth, not just in Africa, but across the Commonwealth, competing with hospitals in the UK. Would you say that the trajectory of this grand place has remained consistent, or have we seen a decay?
I think looking around, there's been a decay. We've always had the problem of maintenance in Nigeria, and the government should begin to look at it that after you build, you need to maintain. If you don't maintain, it decays, and that's what we're seeing. Usage had
this is a very grand structure.
Fantastic structure all over, everywhere, different ways. And it was so well planned, and they took advantage of the environment. So you can see that in most of the wards, you're not going to have to put electricity or anything, because on both sides there's light coming in. Yeah. So for most of the day, nobody uses electricity. Yeah. And then the ventilation comes in, the air flows.
So the planning is great.
Fantastic planning.
But I look now and I see peeling, paint.
Not only peelings, even in between the buildings, we are putting structures to obstruct the original concept. And I think that's the part of the problem with us, not maintaining things as they should be. And remembering that building a structure also requires that you allocate some money annually to maintain the structures.
Generally speaking, we are really, our health system is really weak. We have only 256 ICU beds, intensive care units.
In the whole of the country?
In the whole of the country, currently functional. Only 256 ICU beds.
Just for clarity, let me just ask you to clarify. So 250 ICU beds, this is in the public sector hospitals?
Including the private sector, functional ICU beds.
Wow.
Yes, functional ICU beds. And the surprising thing is, even with the COVID pandemic, we only have a handful of people at any one time on ventilators. Last week, we had about 4 persons out on ventilators out of the 256. Why? Most likely because the majority come in They don't have access to secure oxygen supply, and they die before they are even intubated.
You wrote, actually, in January 2010, if we do not invest in protecting the Nigerian people from the threat of infectious diseases, we will pay the price. It's only a matter of time, and not even the high walls of the 3-arms zone or bulletproof 4x4s will save our politicians. Those little things, assuming you're referring to viruses, have no respect. Prophetic words, in many ways, if we look at what's going on with the pandemic. Do you think it has become clear to the political class in the 3-arms zones that they need to take public health a little bit more seriously?
I think that right now it has become clear because there have been every cadre of Nigerian society has been affected. The fact is we have about seven governors that have been affected. They communicated this mostly themselves and many other parts of the country. So I think right now everybody is acutely aware of the risks that we face. But I worry that our memory in Nigeria is very short. So very often, if you ask Nigerians what they want, and you know, all of us, I'm part of it, we ask for security, infrastructure, electricity, and those things that are more present to us day to day, because health is only a problem when you lose it. Unfortunately, in public health, sometimes you can't gain a lot of political capital from investments in health because you can't really bring people to cut the tapes of the type of investments we need to make.
What do we need?
So from bottom up, we need a refocus on science education. Even before we get to NCC and all of that, we need to inspire a whole new generation of Nigerians into the sciences.
You know, when someone from the outside looks at the College of Medicine, particularly because it is the College of Medicine of University of Ibadan, the premier university in Nigeria, with the historical way it was set up, the reputation it has, we kind of expect this place to have everything. You know, we think that this is a place that if you walk into, should have all the facilities, all the resources it needs to be able to do things, you know, that are even complex. Are you happy with what is available to the college?
Let me start by saying that infectious diseases it's the core of a lot of what we do in clinical practice across all specialties. And while there has been a lot of investment, when you think about things like HIV, malaria, TB, even COVID-19, it is clear that we're not ready for these pandemics. And when you think about what we need to do to get ready, we need to invest a lot more heavily. We need to invest in human resources. We have a situation in front of us. I think all of us need to go back to the drawing board and say, even at the undergraduate level, whether it's for nursing students, medical students, physiotherapy students, how do we prepare those people for what might be coming in the future? The College of Medicine and the university at large has been involved in developing a security blueprint for health. The university was commissioned to do that. And we need to look at those kind of documents and implement them. We need to prepare our students of today for the challenges of tomorrow and not just react to the challenges when they arise. This is not going to be our last pandemic. And we need to prepare for the next one and the next one.
When a student is going into a place like Harvard or any world-class university, their school fees, which includes tuition, accommodation, feeding, everything, is about between 50 and 60,000 US dollars a year. And that is what the university receives per student. One of the areas in which I believe would help us in terms of getting appropriate funding is to assess if a medical student is coming to train in, let's say, College of Medicine, University of Ibadan, how much is it going to cost to train a student per year?
Properly, yes.
Yes. So if it's going to cost 20,000 US dollars, or let's say 2 million naira per annum, or 4 million, or whatever,
the government should calculate it such that that money comes in to that university. And that student could then have access to tuition, that would cover their tuition, accommodation, and everything. Now, in Harvard, you find very few people can afford $60,000 US. So what they do is they make loans and scholarships available. So that's one of the ways in which we can also operate here. The federal government, private organizations. I mean, we know we have private institutions, and they charge fees. They charge competitive fees, and their services So the government too should look and calculate based on, you have one person studying physiotherapy. How much does it cost for that student to study 1 year? So that person will have decent education, decent accommodation, books and everything, and a full package. I think that's the way in which we need to start looking at things, per cost.
We have once again just witnessed and experienced the beauty and majesty of our democracy. The laying of the budget proposal by Mr. President before the legislature for consideration and approval. When just over a year ago, we gathered in this chamber to receive the budget proposal and begin the appropriation process, we made specific commitments to the Nigerian people. We promised that we would pass the budget promptly, free of the rancor that had bedeviled the process in times past, and we delivered on that promise. I do not doubt that we will exhibit the same commitment to nation building and deliver a good budget on time. The world changes quickly, often without notice, and always with consequences. We have learned this lesson at a high cost in the past few months, and we must ensure that the lessons learned are reflected in the budget that emerges from the appropriations process.
I hope in 2021, even though the fiscal space is very tight, but I hope in 2021 the health budget would really reflect the importance of health when it comes to national development. It's very likely that what we would see is additional prioritization of health over the next few years. Within the COVID budget itself, we've already made accommodation to build isolation and treatment facilities, 43 to 45 bed facilities in every state, one per state, in a federal teaching hospital or federal medical center.
You don't really build what you need to fight a war during the war. It's inefficient, you don't give it the diligence it requires, and so we're going to go back. But going back to the first point is, we have to invest in these in peacetime. And it means that we need the National Assembly to appropriate the funds even after the outbreak, and not to think, okay, the outbreak is over, let's go back to business as usual. Because it's only what we build in peacetime that we can activate in wartime. And that was the big difference in the West, you know. What they managed, they already had the lab. So what they needed to do was switch the testing from one type of disease to another. But we had to build up the lab infrastructure. So at the beginning, even if they offered us reagents and all, we didn't have the labs and the human resources, the skilled expertise to absorb the support that we needed to save the country.
The annual salary of one member of the House of Representatives, approximately 17 million naira, can pay at least 10 entry-level doctors. And that's not all. A senator's salary of 24 million naira is equal to the wages of at least 14 entry-level doctors. The refurbishment bill for the National Assembly is now 115 billion. That is 3 times the budget of the Ministry of Science and Technology. Almost 5 times, I think, twice Ministry of Education, etc., etc. And people are saying, how can you in all consciousness appropriate to yourself that sort of money at a time when limited resources and urgent needs in the health sector?
I think it's important to do a comparative analysis of the budget of underdeveloped, developing, undeveloped legislatures, what is their budget? What if I tell you that today in the National Assembly, we're using the most archaic, that's why we don't have electronic system in the National Assembly. You can't even find the parts anymore. You can't find the parts. When we wrote to those who manufactured, they were shocked that Nigeria still has this thing that was developed 40, 50 years ago, that people are even in Africa, they've gone way beyond that. That costs money. Nigeria is perhaps the biggest country in Africa, and we show off for it. How do you explain that your legislature does not have a library?
The same way you explained that schools don't have running water and hospitals don't have toilets.
Hold on a second. When you talk about the National Assembly, you're not talking about members sitting down there and you say 115 billion. That's another misconception. The National Assembly includes the Public Complaints Commission, includes the Institute of Legislative Studies, includes National Assembly Service Commission, includes several departments, includes the AIDS, includes so many other areas. It's not just 360 members in the House and 109 senators. No, that's not it. It's a misconception. It does us a great disservice when you single out the National Assembly and you look at 115 billion. If you divvy up 115 billion amongst everything I've told you, you see that comes to pittance.
Think about the human resource side of healthcare. It's not always about infrastructure, and it's not always about ventilators. It's actually about the human beings that will bring it all together. Our thought process was that if these people can't take care of themselves, if they can't provide for their families, how dedicated can they possibly be to the task ahead, given that they're risking their lives? And then we then realized that even those that were in the forefront of the fight against COVID were not being paid hazard allowance.
I was aghast when I found out that we weren't being paid health hazard, or that doctors were not being paid their allowances, hazard allowances. And I have pursued that vigorously with all the might in me. And as a matter of fact, the last budget, I made it clear to members that we're not going to pass this budget until I see the hazard allowance in the budget, because it wasn't in the budget, and we put it in the budget. And I guess maybe it was an oversight, and was ratified by Mr. President. So yes, it's again, it's getting our priorities right. You know, where you cannot have a country, an unhealthy country. So health is probably one of the most important sectors in any economy.
With the nation in the grip of a looming pandemic, Nigeria's House of Representatives choose to display a troubling lack of sensitivity to the situation. They resolve to acquire for themselves 400 units of the latest Toyota vehicles as official cars. The cost ranged from 26.75 million to 35.75 million naira each.
COVID will define good leadership, and the storm has only just started in terms of the socio-economic impact. There's no doubt the fiscal space is very tight. There's no doubt that we need to run a lean government. At the state level, it's even more obvious because they have responsibilities for education, for health, for infrastructure at the state level, etc. And there really isn't enough money. But it's also about prioritization and also about effective communication with the public.
Years of corruption, poor investment in healthcare infrastructure had brought the healthcare system to its knees. This pandemic only peeled off the veneer.
We hope, and this is really hope, I really hope that we've learned our lesson. I really hope that moving forward, we put in place infrastructure, particularly at the primary healthcare level, to make sure that our population have access to decent healthcare. Decent healthcare is expensive, there's no doubt about it, and it will require complete restructuring of the way government works. It will require a change in terms of the number of ministries we have, or the number of MDAs trying to contract government, so that the private sector can have a bigger space to play. So that those things that we don't need to spend on as government, we can actually ask the private sector to do, and we can redirect our resources to those aspects such as health and education and parts of infrastructure that is the responsibility of government.
One of the good things also about coronavirus is this realization that for the first time in Nigeria's history, the elites were trapped.
Nowhere to run.
Nowhere to go, nowhere to run to. And that gave me a lot of food for thought while I was in isolation, and in many ways framed the way we would redesign and push public policy going forward.
Will we see you stop people who are public office holders from traveling abroad for treatment, much in the same way that you've made a law around education and ensuring that public office holders send their children to public schools?
Yes, I think that's the direction we are going, most definitely.
I mean, it's an interesting idea, but you could argue the same about almost any other sector. Should we force Nigerians to only fly Nigeria Airways? Should we?
But there's no Nigeria Airways.
Well, do we need one? But my point is, I do think we're a fairly libertarian society. So we are educated to compete, educated to be the best that we can be individually. But great societies are not built by great individuals. They are built when great individuals come together to value certain parts of society and build them up.
Nigeria has never been lacking in resources or even in the human energy and the desire to succeed. To a large extent, we've been distracted by easier ways. The best example is to think of what happened when very brilliant engineers come out of university. They end up working in oil companies. So they're not working in manufacturing, they're not working in building the fabric for industrialization for this country. They're not doing that. And that is because they get paid they get a better package in the oil industry. That is not the best place to put your best resources. And we see the same thing happen with financial services when people come out of school with degrees in medicine or engineering and they end up working for a financial institution. That level of financialization, which draws resources from the core of the economy, is very damaging long term. But as a country, we have always known that oil has been a distraction for us. Oil has prevented us from investing in the infrastructure that we needed to invest in. But also, oil has subsidized imported consumption. And for as long as we had enough oil flow to subsidize our imported consumption, what tended to happen was that we killed the local production capacity.
Human capital starts from when you're conceived in the uterus, in the womb. So right from the moment you're born till you're about 5 years old, the state has to ensure that all our next generation are well developed, good brain development, and then you subject them to good education. That together gives you what we call human capital. And with human capital, you can drive your economy. So we've got to focus on health and education and make sure that we have the next generation of people that can compete to drive the state and the national economy. If we fall back on that, then we will forever be behind the curve of global welfare and global competitiveness.
The human resource has to now be at the center of everything else, and that has to be the starting point. As to what the state should do, I think we have locked the state into a space where they are not able to compete against each other because the policies that will lead to competition are centrally defined. I think that we should allow freedom for the state to set their economic environment. If you've seen where, within the limited power that the states have, those that have set the right economic environment have seen an inflow of capital and an inflow of people. If we expand that power, what would happen is people will experiment with different models. There are some that would think that they don't want to be business friendly, and there are those that want to be business friendly. But give it 4 years, the result will show. I feel that COVID revealed the rot, but it also revealed the opportunity. So there were things that we thought was impossible before that suddenly has become the norm. We have now found ourselves building hospitals and isolation centers in weeks, in days. It may not be the 1,000-bed hospital that was built in Wuhan, but we've seen Nigeria, using local resources, put in place usable hospital facilities in weeks. We've seen young people come up with ideas that can translate into building ventilators locally produced. We've also seen the government intervening in the healthcare sector. We have argued for healthcare for about 5 years now, and suddenly we have a huge fund approved by the central bank for the purpose of healthcare. So it has sort of freed us also from the illusion that we can continue to import everything and be okay. It has freed us from the idea that the hard work of rebuilding our healthcare system was something we could do without, that we could just simply ship our sick parents to India or to the United Kingdom. That reality has dawned on us.
We have enough talents in this country to do what we want to do for us, to solve our problem. I used to say one thing: we have all it takes to solve our problem, but we will not take all we have, and that's where our problem is.
If we can get more people into the labor market and if we can improve productivity per capita, those two things come together, and every other thing you've described becomes easy to deal with. In two ways. Obviously, if people are employed and they have a gainful, they have an income that is reasonable, then they start to provide some of these things for themselves, even before government intervenes. The second point is that when more people are employed and they're able to pay taxes, then it's easier to hold government accountable to also provide facilities and social infrastructure. So the focus has to be, how do we get people employed? One of the reasons why a lot of our people are unemployed is that we continue to export jobs. And the way we export jobs are that we consume things that are produced elsewhere. And for everything that is produced somewhere else that you consume, the labor component of that is out there, not in here. We also continue to actually physically import labor because the skill sets that are required and the educational system that has failed over time has meant that you actually cannot deliver output if you don't bring in labor from abroad. And this could be something as complex as bringing in technologists to come and help you set up a factory, or it could be something as simple as bringing in a chef from across the border. The reality is that we cannot continue to export jobs and expect our people to prosper. From there, would now be used to expand the social register and to begin to get more resources to the bottom of the pyramid, because we need to keep supporting them pending when the economy is robust enough to offer them jobs. We cannot afford to stop supporting the poorest people, and I think that support should be.
Why does that matter? Why does the fate of the people at the bottom of the pyramid matter?
Well, from a purely selfish perspective is that you don't want people in your society who have nothing to lose. But from a broader perspective, if I look at it from the perspective of the economy, there are resources, human resources. These people, when you apply them properly to capital and to land resources, you create output. So prosperity is actually the result of getting these people into the productive process.
For Nigerians to do what we need to do collectively, it means that there has to be a sense of trust between the government and the people.
For me, when I look back on the time, I say, I owe this country much more than I can ever pay back. But the generation can't say that.
The problems we do not solve today, when we have the opportunity or we're in a position to, the same troubles will bite us tomorrow.
Who do you call your hero? Who do you celebrate? A guy gets into EFCC, steals money, manages to do plea bargain, spends 6 months in prison. The next day, he's a chief in his town.
There's a convoy welcoming him.
Yeah, and then the whole town comes out beating and drumming. So that's what I'm saying. But the more you steal, the better you become in the country. When it's still the people, I use the word attitude. If all of us oppose that thing and say, no, we're not going to allow that kind of thing, that type of situation, then, they won't come out and be doing what they're doing.
So as citizens, you're talking about the responsibility of citizens themselves. Yeah. Because often when we talk about the problems of Nigeria, there's always a focus on government. And I mean, rightfully so. It's not as if government doesn't have responsibility. But you're saying citizens also have responsibility.
We have a role. I mean, we get the government that we deserve, as people say, because we allowed them.
Globally, there is conversation that is going on about the failure of capitalism as currently constituted. And in fact, even though we're doing very badly, the truth is the countries that traditionally we looked up to, the United States, the UK, the European countries, many of them are in trouble. And the general belief is that actually this ideology that we've been pursuing, where we believe the market will take care of everything, is actually to blame, because there is more inequality today in the world than there has ever been. The gap between the rich and the poor is getting wider. A tiny percentage of people globally control the wealth of the world. And so if even places that are sort of more far advanced than us are sort of grappling with these issues and questioning whether that is, what they've done, the policies they've pursued are the right way, why should we sort of go through their journey? Why are we looking to follow those footsteps when we could be rethinking things that are sort of maybe slightly different?
The capitalist system came up with a system for bringing resources together. I don't think that system has failed. I don't think the market system has failed. I think governance has failed. I think irrespective of what you practice, if the governance doesn't exist, it will fail. I don't think religion has failed. I think the governance of religion has failed, and that's why we have extremism. It's not because religion itself has broken. I don't think capitalism itself has broken. I think people refuse to enforce capitalism and the rules of capitalism. I'll give you an example. One of the major defects is that people who are very wealthy have not been paying the right amount of taxes. So it's estimated that over $5 trillion worth of taxes was avoided in the United States by the billionaires. Maybe that is true, but that is not a failure of capitalism. That's a human failure. Somebody did not enforce the rules for that. And how did we get to the point where capital and those who control resources have they play such a significant role in determining political outcomes? Because more than 40%, sometimes 50% of people will not vote. If you do not vote, then the candidate that is likely to win will not represent your interest. So that is not a failure of democracy. It's a failure of people. Now, the fundamental failure that has driven both the governance issue and the lack of participation, to my mind, is education. Until we begin to pay more attention to ensure that every single person has this decent level of education and I would say, understanding of how resources are allocated, then we'll have a problem. If you look at the forces that have led to the rise of populism, it's generally people who are not well educated, people who do not understand the implication of their action.
And people that are paying a really high price for globalization, who don't have health care, whose children, go to school hungry, who generally are looking around, and while it seems the world is, running and leaving them behind, essentially.
Correct. And the reason we got to that point was that their interests were not being protected within the democracy. And the reason their interests were not being protected was that they've not organized and participated to make sure that they were considered. So it's simply a question of, you choose a system, the rules are clear, we need to make sure people participate in the system, otherwise it will break down. The other point is that there is no clarity, there's no certainty that there's an alternative model today to deliver the kind of growth and productivity that we have seen. So even though inequality has reached a certain level, the reality is that the quality of life for most people in the last 50 years under the system has improved significantly. In fact, never in the history of humanity have people lived that quality. Have you had so many people outside poverty? Fixing the issues, I think this is down to, do you want to throw away the baby with the bathwater? I don't think that the market system is this. It is clear that it creates a lot of economic value. Even the countries that are not capitalist in outlook, like China, they're dependent almost entirely on the market system to drive resource allocation. Because even though they have some level of central allocation of resources for production, when it comes to distribution and market, it is actually driven by the individuals and their preferences. So we need to take what is good about this system. And the part of the system that is broken is not the market system, it is the governance.
At a point we used to beg. At a point we used to cry. But now we are not doing either. We are standing our feet because it is our fundamental human right. We have the right to speak. Let your voice not be silenced.
I have willingly come to a protest where there's very little social distancing and very few masks. And the reason is this: young Nigerians are fighting against a pandemic that is taking their lives. A pandemic that seems to be much worse than COVID. Police brutality. Across the country, young people are taking to the streets protesting the fact that an anti-robbery squad, which was set up to tackle armed robbers, has essentially become something that is being used to rob young people. And they've had enough. They're saying enough is enough. They want to take this country back because as far as they're concerned, this pandemic is much bigger than COVID. And so they're out on the streets, risking their lives, knowing that it is possible they get infected, but they're willing to do it because they're saying something has to be done. From health to education to our economy, all the way to subnational and federal governance. Amidst all this, one word kept popping into my head: trust.
We don't trust our government. The government doesn't trust us. We don't trust them. They lie to us every day.
Them care about their pockets, care about their power. They want to perpetuate themselves in office. It's not about the people.
COVID will define good leadership. And the storm has only just started in terms of the socio-economic impact.
If anything, what COVID has done is to unmask the truth and remind us that challenges often happen when we least expect, and that the big test of our nationhood is likely to come without warning. But if we prepare now, we may not end up a casualty of the times or be forced to say a tearful farewell to our loved ones or our nation.